Hey, Dr. Victoria Munoz here. I'm happy to announce the official launch of our TG Wellbeing TRT clinic. It's been long in the making. We've been spending the last year fine-tuning and perfecting the program to bring the best medicine in the world to you. First, I want to start by talking about what sets TG Wellbeing apart from other TRT clinics. Well, first of all, you are actually reviewing your labs directly with a sports medicine doctor, myself, and so you're getting a good explanation of what we're going to do about labs that are out of balance, why it's important to modulate them, and how they work together. Secondly, we offer comprehensive lab panels that I've designed myself to ensure that you get the best results possible with your hormone modulation. The reason we look at a wide variety of hormones and not just testosterone, for example, is because hormones work together. They do not work in isolation. And if one is off, another might be off. Or if you're having a vague symptom like fatigue, for example, it could be related to thyroid, it could be related to testosterone levels, or it could be something else. The third thing that sets us apart from other hormone clinics is that we are affiliated with TG, the gym, where people come to get results. So what are the benefits of optimizing your hormones? Hormones are chemical messengers that go out into the body targeting certain cells to do a certain job. So basically, hormones are life. When your hormones start to decline, your life expectancy starts to shorten, and when your hormones are essentially negligible, we die. It's important to keep our hormones optimized, not at the level that is indicated for your age. So, for example, if you're a 50-year-old male and your hormones are that of a 50-year-old, we don't want that. What we want is you to keep your hormone levels at optimal levels. We're primarily talking about testosterone here in order to ensure longevity, quality of life, and also for the prevention of chronic disease. And yes, testosterone is the primary hormone that we modulate, even though we look at other hormones. We could also do thyroid replacement therapy. If men are aromatizing their estrogen, for example, we would give an aromatase inhibitor, and there'll be more about that coming up. But even though testosterone is the primary hormone that we look at, we need to look at all hormones because they all play together. And that leads to our next question, though. Testosterone is the focus of our treatment. Why are there other hormones important to assess? And that is why, because hormones are like a symphony that orchestrate this dynamic in the human body that creates life. I'd also like to preface that yes, women need testosterone too. It is not a male hormone, even though men have higher levels naturally than women. If women's levels start to decline, so does their quality of life, so does their life expectancy, and so does their susceptibility to chronic disease. All right, so that being said, let's talk about the panels and what we're looking at. So I'm going to just list it off. So for the male lab panel, we have hematocrit, testosterone total, testosterone free, sex hormone binding globulin, albumin, vitamin D, and then we have our lipid profile, which is cholesterol, total, HDL, LDL, triglycerides, and estradiol for men. Women, their panel is very similar. Everything is the same, except we do an estradiol sensitivity with women just because estrogen plays a different role in women than it does men, just like testosterone for men and women, same thing. And also let me make it very clear that men also need estrogen, just at a lower level. So again, by bringing the hormones into balance, whether you're male or female, is going to make a huge difference in your quality of life, your longevity, and the prevention of chronic disease. So of course we run the testosterone simply because testosterone is the primary player in our ability to maintain lean muscle mass throughout our life, which also equals longevity. It's also important for cognitive function, the reduction of inflammation in the body, sex drive, drive in general, focus, concentration, all that. And then We want to look at free hormones because the free hormones are the hormones that do the work. We have the measure of the total testosterone, which is different for men and women. And then we have the measure of the free testosterone, again, which is different for men and women. But we specifically look at the free to see how much of the hormone is available to do work. Hematocrit, the viscosity of the blood can change with our testosterone levels. However, we almost never see that change when we're doing TRT at a therapeutic level. It's either for other reasons like infection or inflammation, or because somebody is using high levels of anabolic steroids. Sex hormone binding globulin is just how much of the testosterone is free and bound, and it can also be a measure of inflammation. Albumin, again, same thing. Vitamin D, of course, vitamin D is a hormone. It's very important. The reason that vitamin D is important is because it plays a major role in our immune function, our cognitive function, and because it is a hormone, it plays a very major role in the production of other hormones. Then we have our lipid panel. The total cholesterol, obviously, is the total of all the numbers. HDL is the measure of heart health. LDL is a measure of immune health. And I guess what I mean by that is these numbers kind of show us where we are with our heart health, our immune health, and so on. And then we have triglycerides. Now, I'm going to give a brief explanation of what a lipid panel means and why. So, we do not want low cholesterol. Okay, that is a myth, and I'm going to debunk it right now. There's no evidence, there's no study, there's no proof anywhere on the face of this planet that cholesterol causes disease. I'm going to repeat that. There is no evidence that cholesterol causes disease, particularly heart disease. Now, what we do see is when triglycerides go up, inflammation in the body goes up, and that's when we're more susceptible to disease, heart disease, and any other disease, chronic illness of any kind. When inflammation is high in the body, we also have aches and pains, brain fog, our hormones are in the tank. There's a lot of reasons why we don't want our triglycerides to be high. Triglycerides are a true measure of our risk for heart disease, for example, and we want those to be low. Now, triglycerides are also a direct result of the carbohydrates in our diet, not the saturated fat. So my patients that eat an animal-based diet, particularly carnivore, they typically have the best lipid profile of anybody with the high cholesterol, the low triglycerides. They rarely get sick. They don't have signs of heart disease, and they get the best health outcome. We're not going to go a lot into that in this program. I go more into that on other videos on my YouTube channel, and it is more of a focus of patients with my private practice. However, for what we're doing here, I'd like to give patients an understanding of what we're looking at and why. And then there's the estradiol for men. Now, what happens is men can genetically have a propensity toward aromatizing their testosterone. And what that means is their estradiol will start to go up, meaning the testosterone is converting into estrogen by going down that pathway. If that is the case with men, whether it's before modulating hormones or after we start TRT, we can give an aromatase inhibitor. Basically what it does is it just blocks that pathway. There's virtually no side effects to these medications, and they work amazingly well in preventing that estrogen from going up in men. We do not want that. When we see male patterned disease, such as cancer of the prostate, hypertrophy of the prostate, this is more related to high estrogen levels and not testosterone. For women, the only thing that's different is the estradiol sensitivity measure. We do want to look at this in our female patients, even though we're not necessarily modulating estrogen with this program. That would be more of a GYN issue, but we are definitely looking at and modulating testosterone as needed. And like I said, women need testosterone too. There's a lot of false information on the internet. I recommend you quit going to Google, Googling your symptoms, and then Googling your health care issues, and talk to a qualified doctor like myself. I specialize in hormone modulation, metabolic health, and I know how to get results. One more lab, and that is TSH, which I forgot to mention up here on the male lab. TSH is thyroid stimulating hormone. With this program, with this lab panel, because we're just getting a snapshot of your hormones, we're not running a full thyroid panel. However, the TSH gives us information into how the thyroid might be working. For example, TSH is a stimulating hormone that when the thyroid needs to increase its amount of production of T4, and this is a negative feedback loop. It's waxing and waning all day, every day to keep it in balance. We want the TSH to be between 1 and 2. Now, just because it's between 1 and 2 doesn't mean your thyroid is functioning properly, but it is a snapshot. It is just a screening lab that we do for this. And if we're needing to run a full panel, we can talk about that. So anyway, guys, that is the hormone panel in a nutshell. I hope you will at least do your first lab kit, sign up for your lab review, and we can talk more about your health and how to improve it. Hey guys, I'm Dr. Victoria Munoz. Till next time, take care.